Well, China is battling a new mosquito-borne and transmitted virus. It's called chikungunya, which has over 7,000 cases so far. China is even bringing back COVID-like measures to try to contain the spread. The United States has even issued a travel warning alerting Americans to stay away from the outbreak region. Fox News medical analyst Dr. Marc Siegel is here with what we need to know. Dr. Siegel, thanks for coming on.
Great to see you, Ainsley.
So how worried should we be here in America?
Well, we're seeing a lot more mosquito-borne viruses right now. Dengue, chikungunya, Zika, and that's what we should be concerned about. There were 640,000 cases of this particular virus last year, and it's increasing. And this particular mosquito really is hardy. It breeds on very little bits of water, and it's hard to get rid of it. I'm also really concerned about the draconian measures that China is bringing back into place to try to control a virus where they're going to have no success whatsoever. Yet they're sending people in red vests to houses to make sure you don't have any stagnant water in the house. They're spraying you with insect repellent if you enter the city. They got drone planes flying overhead looking for stagnant water, sending a message that personal liberty is meaningless. That's the problem we had with COVID, and that didn't just occur in China, as you know. It spread to the rest of the world, including the United States with lockdowns. You're not going to be able to get rid of this virus this way, and it sends a wrong message about what public health is.
Yeah, and if you have stagnant water, they're going to fine you the equivalent of $1,400, and they'll turn your electricity off. Here are some of the stats. There are 240,000 cases from January through July in China. There are 7,000 as of... Oh, this is around the world. Okay, thank you. 7,000 as of Wednesday and 90 virus-related deaths. Now, I was talking to you during the break. We were so concerned during COVID because people were traveling into America and they were bringing the disease here. Can these mosquitoes get on the planes, get in the cargo?
Well, I told you, they can't buy a ticket, but they can get in the luggage. They can hide in cargo bays. They can live on tiny little bits of water. Their eggs can last forever, even if they're dried out. And the virus itself can get you pretty sick. You get bone pain, you get muscle pain, you get high fevers. So it's nothing to take lightly. It gets people very, very sick. And it's spreading. And yes, they can come here. And then, Ainsley, they can seed our particular mosquitoes. We got a ton of these Aedes mosquitoes, AEDES, in the Southwest in Florida, and that's why not only travelers bring it here, but the mosquitoes come here as well.
Yeah, what are the symptoms? You mentioned the bone pain, you said. What are some other symptoms?
Bone pain, muscle pain. You can get a rash, you get headache, you get fatigue, you get nausea. The headache can be pretty prominent. Unfortunately, you can even get inflammation like encephalitis. So like West Nile virus, same idea. So these are particularly worrisome symptoms, and it's not usually deadly, but it can get you sick. And the bone pain and the muscle pain can last for many weeks.
I remember during Zika, I remember if you were pregnant, they said don't travel to certain countries. So.
This isn't as risk for pregnancy the way Zika is, but I'm glad you brought that up because it's very hard sometimes to distinguish between Zika and dengue and this because they go on the same mosquito.
All right, Dr. Siegel, thank you so much for coming on. Great to see you.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.